Masseter hypertrophy. If you have difficulty seeing the masseter, ask the patient to bite. The masseter will pop out from the patient. A hypertrophied masseter already indicates a significant occlusal load. Masseter, when you perform in the extraoral evaluation, which is pillar 1, that I will teach you next week, palpate this masseter. And if the patient feels pain, it means that this muscle is under overload. So be careful. It might be on the verge of having a fracture or experiencing pain that doesn't match the reality of health. And then you come and say, I am from HOF. I will take charge and administer botulinum toxin to this patient. Dear ones, I want to say the following. There is scientific evidence showing that botulinum toxin is not a treatment for bruxism. And that botulinum toxin, I brought some studies for you. Botulinum toxin can have a bias depending on the amount applied. It can lead to a bias of permanent loss of masticatory strength, reduction of this masticatory strength, depending on the number of applications. And besides that, what can happen? There are already some studies showing bone resorption. So am I against the toxin? No, of course not. But I want to tell you that you can't just turn to a patient with masseter hypertrophy and say botulinum toxin and goodbye. No. Even if you do it for aesthetic reasons, often the patient doesn't complain of pain and isn't breaking their teeth. But they have masseter hypertrophy. I'm going to do it for aesthetics. How are you going to do it for aesthetics without making a differential diagnosis, knowing whether this patient has bruxism or not? So be careful with the issue of cause and consequence. So if you want to know more about these topics, start following me and share with more dentists.